Female bladder catheterization pill. Material to be used: sterile material, sterile tray, sterile gloves, antiseptic solution 2% chlorhexidine, 2 sterile drapes, sterile gauze, number 14, 16, and 18 urinary catheters, water-soluble lubricants, do not use Vaseline, 1 10 ml syringe, ampoule of distilled water 10 ml, urine collection bag. Non-sterile material: tray, soaker, clean non-sterile gloves, hydroalcoholic solution, bag holder or hook. Hygienic hand washing for 30 seconds with hydroalcoholic solution. Put on the non-sterile gloves. Prepare the material. Remove the gloves. Hygienic hand washing for 30 seconds with hydroalcoholic solution. Prepare the sterile field. Hygienic hand washing for 30 seconds with hydroalcoholic solution. Put on non-sterile gloves. Inform the patient about the technique to be performed. Provide a private environment. Position yourself on the patient's right side. Palpate the bladder for urine retention. 1-2 centimeters above the pubic symphysis. Place the swab under the patient's perineum. Ask the patient to stay in the supine position with knees bent. Wash the genitals with 2% chlorhexidine, always from front to back or from top to bottom and from the inside to outside. Remove the gloves. Hygienic hand washing for 30 seconds with hydroalcoholic solution. Put on the sterile gloves. Place the sterile drape between the patient's legs, opening the drape by the corners. Place the sterile basin between the patient's legs. Take the bladder catheter and check that the balloon works, introducing about 7 milliliters of distilled water and emptying it later. Lubricate the last 3 to 5 centimeters of the bladder catheter. Take the bladder catheter with the right hand. Make a loop and separate the labia majora and labia minora with the index finger and thumb of the left hand. Insert the bladder catheter to the funnel or collecting pavilion and make sure that the urine comes out. Connect the collection bag to the bladder catheter. Inflate the balloon of the bladder catheter with 10 milliliters of distilled water. Withdraw the bladder catheter gently until a slight stop is felt. Attach the bag holder or hook to the collection bag and leave it lower than the patient's bladder. Remove the material. Remove the gloves. Hygienic hand washing for 30 seconds with hydroalcoholic solution. Record the activity, date and time of performance, type of catheter, amount of distilled water introduced in balloon, amount of urine drain, color and appearance, existence of difficulties or complications.